Live. Welcome, everyone, and to a new appointment of this informal and friendly book presentation. Today, I have the honor of having as a guest Dr. Filippo Tesler, and we will talk about his book, A History of Cardiac Surgery. Dr. Filippo Tesler has been involved in cardiac surgery for the past 50 years. He not only witnessed, but he participated in the incredible evolution that heart surgery has had in the last 50 years. Has been work with among the most famous and renowned heart surgeons around the world, including Dr. Debecky and Dr. Denton Cooley. He spent several years in Houston, where he completed his training after coming from Italy. And then he was appointed chief in south of Italy for several years. Dr. Tesler has also been the reference point for the School of Cardiac Surgery in the foundation of Ettore Majorana, a special school that organized very high-profile courses for young cardiothoracic surgeons in Europe, in Sicily. I've witnessed one of these courses myself when I was a resident, and it was a very good and excellent course to participate. Dr. Filippo Tesler, and welcome, and thank you for being here today. Professor, can you hear me?
Hello?
Hello, can you hear me?
I can hear you.
We have, okay, yes. We have some communication issues.
Well, I'm sorry, I couldn't hear well.
Yeah, we have some communication issue. We are not able to establish a very safe connection, but we'll try to do our best here. Where are you in this moment?
Okay. Milan.
In Milan.
Yes.
How is COVID?
We are behaving very carefully, and I must say that most everybody, at least in Milan, is trying to behave cautiously. I mean, we are realizing of the seriousness of the situation, and so we are in sort of a quarantine. Most of us. Shops are open or closed. Some restaurants are virtually closed all the time. Cinemas, theaters, opera, all musical events are not going on. Everything is stopped.
Yeah, it's the challenging time. So this is a good time to read a book when we are alone in our life that has become way less sociable. This is the right time to read and to try to engage in something that we have never had time in our pre-COVID life. And that's what happened to me. And I was extremely interested by your book, and I read your book with a lot of interest, and I found it extremely readable, very enjoyable. The book is A History of Cardiac Surgery. Here we have the book cover. So, Professor Tesler, when did you write the book? In which year did you write the book?
I started writing the book in Italian. The first edition came out in Italy in Italian in 2012, and then I decided to rewrite it virtually, update it and rewrite it in English. And I took more time than Michelangelo did take to paint the Sistine Chapel in Rome to rewrite it entirely in English. And it came out in last year, I mean, 2020. Yes.
2020, I see. And how long did it take? When did you have your original idea to write this book?
Well, it's hard to say. Probably as time went along, because I did realize that surgeons of our generation had the privilege of living a transition from closed heart to the surgery we know today. And I can still remember closed heart commissurotomy. I remember, let's say, the surface hypothermia, which we placed the patients in a cold bath, and then we had about 2-3 minutes in order to make the correction in a very frantic environment at the time.
Oh my God!
We moved on to what we know, with the introduction of the open heart surgery. Everything changed, but all along, new things were discovered coming along and employed, from the heart valves to the coronary artery bypass to everything else that we know today. But
It's been an incredible journey to witness. You have been, as you told me in one of our conversations before this live, at the right time, in the right moment.
I was at the right time in the right place.
Yeah.
I have this privilege, indeed, yes.
That allow you to be an incredible part of this history, also particularly during the time of Houston. How did you end up in Houston? In which year you were in Houston?
I went to Houston I'm Dr. Debecky, who was the chief of surgery, of all surgery in Houston, came for a meeting in Milan, and I was sort of an escort to him. And we had a chat. He liked me, obviously, and he asked me whether I wanted to come to go on with my training in Houston. And I said, I applied, I was accepted. And so in 1968, and the funny thing is that I married my wife one day, and the next day we left for America. So
she immediately knew what mean to get married with a heart surgeon.
Oh, well, I didn't know myself what it was entailed, what it was like at the time,
How was Houston during that year?
I'm sorry?
How was Houston as a city? How was there?
Houston was, to us was fantastic. Obviously, it was completely new. Well, a year before, I did go. With my chief from Milan, Professor Donatelli, who's an excellent surgeon, who unfortunately died age 41 because of hepatitis that he caught in the OR. And we did go all around. We went to Canada. We went to Toronto. We went to Buffalo, where at the time Dr. Subramanian was an excellent pediatric cardiac surgeon. In Buffalo, in Toronto, we met Dr. Mustard, Dr. Bigelow, and then we went to New York. We met Kantrowitz and Dr. Malm, who's an excellent pediatric cardiac surgeon. We went to Washington, where we saw Dr. Morrow, who we called at the time the hypertrophic subaortic stenosis or whatever.
Yeah.
And then we went to Houston, and I forget also somewhere else. Oh, Cleveland, of course. We went to Cleveland, and we met Dr. Effler, who was the chief, and Dr. Favaloro, a few months before he performed the first coronary artery bypass. At the time, they were doing Weinbergs, and of course, we met Mason Sones, and we had this, and for the first time, we saw the coronary arteriography being performed. And,
amazing, incredible.
Yes.
How was just for my out of my curiosity, how was Favaloro? I've always been fascinated by Favaloro. How was him? Did you have the chance to speak with him?
he was a very big man, very friendly. He was very ebullient, I would say. You know, he was used to talk. He used to explain what he was doing. He was quite a South American in a way for the time of character. He was a very nice person, and while completely different from Dr. Effler, who was the chief, who was also very friendly but sort of a little detached, you know, more. But Favaloro was fantastic.
What fascinates me about Favaloro is his history of how he ended up in Cleveland Clinic, and you talk about it in your book.
Well, yes, he went he had some problems with the politics in Argentina. So, and he had went into to practice surgery in a very small hospital somewhere in the Pampas. But then his professor helped him go to the United States, into Cleveland especially. So he moved there, and first as a resident, his first job was a resident. But then he jumped completely right in a very few years. He became an associate. He became.
That is extremely fascinating, no? He arrived there most likely with.
He was there like a resident. He wasn't young anymore, but he had experience in general surgery performed in a small hospital in a small town in Argentina. But he was experienced, of course. But as he came there, he had no titles. He had no formal education. So I'm not sure whether he had to pass his board examination or not. I'm not sure about that. But anyway, in a very few years, he jumped he jumped from being a resident to being a senior surgeon in Cleveland.
We always say that is Favaloro the person who popularized coronary artery bypass grafting, no? And he's also the person who first did the first bypass grafting, or not?
No. There was a few surgeries were performed sporadically. He was the first to, occasionally here and there, a few cases had been performed also in Russia, but we didn't know about it at the time. No, what he did was the fact that he systematically started doing coronary artery bypass. A few cases had been done before, but not. The importance of Favaloro is the fact that he started doing the surgery in a systematic way.
In a systematic fashion.
Also because he had the fortune of being very close to Mason Sones, who had performed the first coronary arteriograms.
Yeah, absolutely.
Very closely with Mason Sones and Favaloro.
Yeah. How was the transition between because Weinberg at the end was a procedure that worked well, at least for certain type of patients. So how did Weinberg change into coronary artery bypass grafting when people start to realize that Weinberg was not as effective as CABG?
Well, soon after the coronary artery bypass, direct coronary artery surgery had been performed, because the Weinberg procedure was sort of indirect way of implanting a mammary artery into the myocardium that would absorb the blood and then was vascularized, but in a sort of very indirect way. When direct coronary artery surgery was started, it was obvious right away that it improved. It was a great improvement over the Weinberg.
Mm-hmm. But Weinberg help, and I stay a little bit in the chapter of coronary bypass because it's one of the niche that I love the most in heart surgery. So the use of internal thoracic artery, how we ended up using the internal thoracic artery, who would you say are the most important contributors in popularizing the use of the internal thoracic artery in cardiac surgery?
Well, I think first of all it was Dr. Green in New York but he performed systematically coronary artery bypass with using internal thoracic artery. The problem was that he used a huge, cumbersome microscope, which made things very difficult, and but it then was demonstrated by Floyd Loop and others, and Dudley Johnson in Milwaukee, that it could be done with normal loops. That the internal thoracic artery could be anastomosed to the coronary using loops. So it was then that it was popularized. And then in a few years, it was obvious that the long-term results of using the mammary artery was an improvement over the saphenous vein.
Over the saphenous vein.
However, it's funny to know that a few people did perform using the mammary arteries without even coronary arteriograms, a coronary angiogram. One was Demikov Kolesov in Moscow, in St. Petersburg, who, of course, the thing was completely unknown to us, and he did that, but just by palpating where the obstruction of the arteries. He systematically did perform implantation of coronary artery bypass using the mammary artery, and also Charlie Bailey, who was a true pioneer, who also performed used the mammary artery in a few patients also without coronary angiogram.
By reading your book, and I spent a lot of times, particularly in the chapter of bypass surgery, in the chapter of transplant, heart transplant, and in the chapter of total artificial heart. By reading your book, there is something that catch my attention. I knew about the contribution of Russian in cardiothoracic surgery, but I did not understand how important and how consistent were Russians in stay ahead of the curve of the invention, both in the coronary surgery and in transplant. Until their papers were known because they had been translated into English, nobody knew about them. But they even very early Demikov did build a heart-lung machine which worked well, apparently, except we didn't know about. Wow. So if I have to tell you who was the first man who did a heart transplant, you will still say is Christian Barnard?
No, with the human, the very first surgeon who did perform a heart transplant using I think a monkey, a heart of a monkey was
a chimpanzee.
Chimpanzee, yes. It was Hardy in Jackson, I think.
Jacksonville.
That of course didn't work, and although other people apparently later on did attempt using animal hearts for transplant in terrible situation. One was Donna Ross in London, and even Dr. Cooley once used a ram heart, which well, anyway.
And the first who did a human to human, who was the first who did human to human?
human was Barnard.
Barnard.
Human was Barnard. Yes. And
So, how was? Let's go a little bit into the story of a heart transplant. How was the news? How did you? Do you remember where you were when you heard that Christian Barnard did the first heart transplant?
Oh yes, I was in Italy, and but the thing was such a bang, and it had become such a popular thing. Came in the news. Barnard had become an international hero, he immediately after his second transplant, he came to Rome and was hailed like a hero. There were so many people. He told me before when he came to Rome, and my chief has taken me to the lunch that was organized. I mean, there was a meeting organized by television, and we had a lunch with Christian Barnard, and he just immediately after he arrived in Rome, he went to the Pope, and they discussed Pope Pio VI, and they discussed the ethics of transplant. Then he went to the president of the Italian Republic at the time, and then he came to this lunch, and so I started chatting with him. Probably I was the only one who could speak English, and so I was translating. There were some doyens, a couple of the very famous, most senior surgeons in Italy present at the time, besides my own chief, who was considered the best heart surgeon in Italy, and two famous old surgeons of Rome who had made the name for themselves because in very early in the 20s or in the early 30s had performed a successful pulmonary embolectomy. Professor Baldoni and Professor Stefanini. Baldoni then is the man who operated upon the chief of the Communist Party in Italy, Palmiro Togliatti, who had been shot by some.
Amazing. How was Christian Barnard as a personal? You had the chance to meet with him. How was him?
Yeah, well, after that I met him several times. That was the very first time, and it was very new to him to be so much in the limelight, and he was quite normal. He was a little amazed that all the things that he, all the people that were surrounding him were. He was surprised in a way. In fact, he asked me. He asked this. He was when he arrived at the airport in Rome, and he saw so many people that he asked whether the Beatles had arrived in Rome. He couldn't believe that he was the object of so much, so much
attention.
But then I met him several other times at meetings, and the last time I think was in India, in Madras.
Mm-hmm.
He changed over the years, of course. He came to Houston soon afterwards, and a few years later, and he was extremely pleasant. He knew how to speak. He was absolutely a great. He had a great way to present things. Completely different from Shamway, who is the actual father of heart transplant, who was very scientific. But Barnard was, how can I say, in the best possible way, a showman. He knew how to enthrall the listeners, the people at the meetings. He relied on
by reading your chapter of heart transplantation, I was very fascinated about the fact that the results of Christian Barnard were excellent.
Yes,
and
indeed.
Even when most of the surgeons around the world stop performing heart transplant.
Yes. Well, he was successful somehow. I'm not sure why, but he is one of the only two who did continue performing heart transplant after everybody else stopped. It was him and Shamway, of course, who continued until systematically Shamway went on, and Barnard was the other one. I must say he was successful. He didn't do many cases, but his results were very good.
Yeah.
He also,
I really don't understand how he was able to have a very successful series of patients surviving among 1 year after heart transplant.
Yes. Oh, yes. Well, nobody really knew why. I don't think anybody knows why, actually. Yeah, but anyway, he didn't do many cases, but he improved the technique. He was a very intelligent man. Unfortunately, his private life sort of marred his reputation.
Yeah. His contribution from a technical point of view, Shamway for sure is the father of a cardiac of heart transplant. But how Christian Barnard learned the Shamway technique?
Oh, but that was
how?
Well, it was by chance in a way, because Dr. Richard Lower, who was Dr. Shamway's associate, went to Virginia, and because he had been invited there in order to proceed with the heart transplant experimentation by Dr. Hume, who was the chief of surgery and wanted to was interested in transplant. He had started with kidney transplants and so on. And Barnard did go there in order to learn about kidney transplantation. And it happened that a man from South Africa who was working as a perfusionist, as a pump technician, knew him and brought him to the lab to watch Richard Lauer perform heart transplants in puppies, and there he was struck with the idea. So he said in Afrikaans, "Is that all it is?" And decided right there and then that he would do a heart transplant. So he went back immediately. He went back to South Africa and started experimenting, improving the technique a little bit technically. Did about 30 experiments, and then he decided to proceed with a human transplant.
Human transplant.
Of course, not really especially in America. Nobody ever forgave him for doing this thing.
How did Shamway reacted to the fact that he was not the first?
Well, Shamway was shocked, but he was a great gentleman, and so he was an absolute gentleman, and so he did congratulate him with Barnard, and however he refused to participate to a talk show with Barnard. He formally congratulated him for his this feat.
This is one of the pictures that I took from your book, and is Christian Barnard with the first patient who received a heart transplantation.
Yes.
And here is another picture of Christian Barnard, Michael Debecky, and Adrian Kantrovitz. Yes. Kantrovitz himself, he was in the he was looking to be the first surgeon who was he wanted to be the first surgeon performing heart transplant.
Yes, yes, but he thought of doing it of performing transplant on small children because his idea because of the less developed
immune.
Yes, but he wasn't the first. As a matter of fact, he did perform later on, not much later, a couple of transplants that didn't function, and never did another transplant in his own later on. He did a couple of transplants that didn't. They were unsuccessful, and he stopped there, and then he never did anymore.
Yeah, that was very interesting to me. He was in the first part of the story of our transplant. Is one of among Dr. Kantrovitz. He pushes to be among the first leaders, but then he had 2 consecutive bad outcomes, and he decided to stop, and he does not want to proceed anymore. And then he became famous for the intra-aortic balloon pump. Is that correct?
Yes, we saw. While we in January 1967, when we went to visit him in Brooklyn, we saw the let's say the first experiments with the balloon pump.
Oh wow!
We saw it was just a prototype. I mean, they were experimenting with that.
How was Dr. Kantrovitz? You met him. What type of? How was his personality? How?
Oh, he was a very big man, very friendly, very nice, and well, that was the only time I really met him. So it was a few short time in hospital at the time, and I never had an occasion to meet him later on. So, but at that time he welcomed us. It was very nice, and so incidentally, we were all my chief Donatelli. He was welcome anywhere. Can you imagine that when we were in Toronto, Dr. Mustard did perform a Mustard operation in the laboratory to show us what it was like.
Wow. Yeah.
So everybody was very helpful at the time. I was the last actor that was just there, but the pioneers were very few, and they did exchange information very, very friendly about it.
Mm-hmm. Very interesting.
And when I say I was there and then, it was like being on the stage. I wasn't the person who to say to be or not to be. My role was to say, Madam, the dinner is served, but I was there.
No, absolutely, but it's.
I was just the second murderer, but the one who doesn't.
But so talking about leaders and pioneer, and talking about your story, we cannot stop this live if we do not talk about Denton Cooley. And here there is a picture here with Christian Barnard, but just beside there is a picture of Denton Cooley and you operating in Houston. Yes. This is early 1970.
Yes.
How long have you been with Dr. Cooley, and how long have you operated with him in Houston?
Oh, about 2 or 3 years. Yes. Dr. Cooley was. I had a very special, superb, ever relation with Dr. Cooley, and I think he was an incredible man. He could have done anything. He decided to be a surgeon, and he was so different from Dr. Debecky, who was also a great man in many ways, and very difficult to get along with. So, us young people were relegated to the very end of the table, and he will still manage to insult us. Very, very difficult person to get along with.
I heard a lot of story about Dr. Debecky at the table and Dr. Cooley at the table. But can you please tell us, you have been with both of them. Tell us something about it.
Yes, well, Dr. Vikki, as I said, was he was a fantastic surgeon. He was, and he was a pioneer in many ways. I always thought that Dr. Debecky was a great surgeon, but for him, surgery was a means to obtain other things, power, not power for himself, but power to get things done. To increase the laboratory, to increase the activity and the of Texas Medical Center, and he was quite an incredible person. He worked extremely hard. While Koolaid for him, I think surgery was the end. While Dr. Debecky surgery, I had the impression, maybe it's not true, but anyway, it was a means. To Koolaid, it was the end. Koolaid was interested in surgery. And he was a fantastic surgeon, and it was very easy to help Dr. Cooley at the table because things were so straightforward, so obvious, apparently. Because, if you try to do the things that he did, he would get into disasters. People looked at him and then went back to Chile or wherever and tried to do the things that he did and ended up in disasters at the table. But everything seems to be so easy, so straightforward, and therefore it was very easy to help him. Of course, sloppiness was not allowed. You shouldn't be sloppy with him. But anyway.
So, and instead, Debecky at the table, I heard he was quite a character.
Oh, he was a terrible character. Not only at the table. He was, he was pretending a lot from everybody and was quite. But anyway, it's funny because when eventually Dr. Debecky came to visit me in my new outfit back when I had come to Italy, he was a completely different person. He was so friendly, so helpful. He would tell me about his early times when he went to Houston in 1948 from New Orleans. He told me of the difficulties that he had. Perhaps he compared my situation with his at the time. He was extremely friendly, a totally different person from the one I knew and feared him in his residence in Houston. And
I have several names popping up in my head of surgeons who I've met or I have worked with who were terrible in the OR at the table, but then so friendly once outside. I mean, it's a common trait, a common character among the...
He was already terrible in the OR. He was terrible
even outside, I say.
In the hospital in general. Yeah, but anyway, he was certainly a great man. He was he realized a lot of important things. The National Library of Health, the MASH, is the man who is responsible for inventing the mobile army surgical hospitals.
Wow.
He used the use of dacron for vascular. Well, the first LVAD that he had Liotta to build, and then let's not forget at the very end of his career, he is the one who, with the NASA engineers, work the present LVAD. With the turbine pump.
Mm-hmm. In one way, we have to give credit to Dr. Debecky for several things.
Many things.
Many things.
Including, still as a student, the roller pump.
Totally. Absolutely. Absolutely. But I've always been, it was very interesting by reading your book to understand how Dr. Debecky had a vision before anybody else that
Indeed.
more than total artificial heart, LVAD was potentially more a feasible solution for treating heart failure patients.
Yes, true.
While instead everybody was fascinated by this idea of total artificial heart.
Mm-hmm. Yes. Well, yes, it's true. It's true. And in fact, when he hired Dr. Liotta Domingo Liotta, this Argentinian surgeon, who was at first in Cleveland, who did build in some total artificial hearts, and still in Argentina and in Cleveland, where he was Dr. Baki asked him to come to Houston, but he didn't allow him to proceed with the realization of a total artificial heart. And as a matter of fact, Liotta was very upset about it, because his idea for 7 years he had these prototypes, total artificial hearts in a case and inside the lab, while Dr. Debecky was asking him to build an LVAD, which he did.
And this was basically the background story of the big fight between DentonCooley and Debecky, no? It's about the total artificial heart.
Yes.
And can you tell us more about it? So how did it start?
I can tell you all about it because I was there. I was participating in the whole thing. Dr. Koolaid, first of all, had someone at the time, but a few people, some surgeons were thinking of the importance of heart transplant, while others were thinking that the future will be a total artificial heart. And Dr. Cooley had realized that the things could be complementary, that a total artificial heart could be used as a, to be used for until a human heart. Mm-hmm. Yes. Well, Dr. Cooley could realize that the artificial heart could be used for a short time until an organ was available. And but anyway, this is Dr. Cooley did speak to Dr. Liotta about the total artificial heart, and Dr. Cooley did work in the weekends in the lab, paying with his money for the experiments that we're performing, and then he indeed decided to utilize it on a human. Of course, we knew nothing about it, but we were there, and then we saw him one morning on Good Friday of 1969. He implanted this first artificial heart in a patient called Oscar Harp, and somehow.
And you were there. You were that day.
As a matter of fact, I was next door. I was next door helping Dr. Brady Holman, who was Dr. Cooley's associate. But as soon as we finished, I rushed to see what Dr. Cooley was doing next door, and I saw this milestone in the history of medicine, not only of surgery. That we all, and the patient, Mr. Hasselhoff, was awake and was quite in good shape from the point of view of intellectual abilities. And Dr. Cooley did transform the OR in which he operated into an intensive care unit for.
And these are the pictures of the patients, and this is his wife who came to the operating room and visited him. But as you were saying, and you say also in the book, and it's very interesting, Dr. Denton Cooley intended the use of the total artificial heart as a bridge to heart transplant.
Exactly, as a bridge, yes. Because he had this intuition, because people were thinking that the answer, the future would be the artificial heart. Others thought of transplant, and he realized it could be sort of the two things could be complementary.
Yeah, and then that really tip off Debecky, and from that day about the use of the total artificial heart from Denton Cooley, the relationship between Debecky and Denton Cooley went to hell, as we can say.
Yes. Well, Dr. Debecky thought or said or whatever that Dr. Cooley had stolen the artificial heart. In fact, it's not so, because the hearts were actually realized were constructed by Dr. Liotta still when he was still back in Argentina, and of course there was a big problem there, because if Dr. Cooley did use the artificial heart using the federal funds that Dr. Debecky had, he would have incurred into a very serious offense. I mean, and then the problem whether a surgeon could independently decide to utilize an unproven device, and while I think that nowadays couldn't be done because of the various limitations made by FDA or whatever, all the various authorities that are allowed or not. While at the time, he just went on,
But then end up that they became back again friends.
Yes, 40 years later.
40 years.
40 years later, after they didn't speak to each other for 40 years, or almost 40 years, Dr. Cooley decided that he was going to. He went up to Dr. Debakey's house. I know it very well because he told me. I mean, I was there. He told me about that. And he went there, and Dr. Debecky was resting or something, and Cooley left word that he wanted to speak to him. He did speak with him a few days later. He invited he nominated him honorary fellow of the Koolaid Society. There was this Denton Cooley Cardiovascular Surgical Society, and then honorary fellow. Dr. Debecky accepted, and there was this ceremony in which I was present. In fact, the photograph is my own. The photograph that I showed I did take, and it was very great for us, who lived the rift between these two giants of surgery, and to see them that so many years later they would be friends again.
Friends, yeah, for sure.
It was a very good thing for us for everybody, for us, especially who had lived through the tragedy in a way of
their enemies, of their tension between them. We have two questions from the audience here that are coming through our social media platform. The first question, and we can show, is how this is probably related to when we were talking about bypass surgery, how the ITA was harvested. I think is during.
Well, I think, as far as I remember, with the first one, they were ligated. The clips came later, as far as I'm concerned.
During Weinberg procedure, I think what was for sure was pedicle. No, that was the first beginning. You did not. The first takedown of the mammary was pedicle, meaning you were taking down the mammary together with the vein, the fascia, and
yes, no, it wasn't. Yes,
was not skeletonized. The skeletonization happened.
originally was not cellularized, and I don't think I remember the first ones whether we used clips or not.
I see.
It's a long time ago, but I think we ligated the
collaterals.
Yes.
Wow. Long time. Then we have a very interesting question. Is a comment and a question.
Yes.
So, and here is the comment. Is the fact that cardiopulmonary bypass was the technology that made possible the explosion of cardiac surgery. But now cardiac surgery is facing a second revolution that is basically no cardiopulmonary bypass, closed chest, beating heart.
Well, everything. This is the progress of medicine in general. No, when I was a resident in general surgery, the most common operation we performed was gastrectomy. Now gastrectomies are very few, and everything proceeds. There are so many things that become. It's both. It works both ways. There are surgical. There are a lot of diseases that were originally medical that became surgical, like coronary artery bypass, as an example, and also the other way around. And of course, nowadays with the improvement in the surgical techniques, I think.
The future. And you dedicated a chapter in your book about, there is the last chapter, the future of cardiothoracic surgery.
Well, I think that, I am the very person who did realize that things had to change, that surgeons had to be trained also in endovascular procedure was Edward Dietrich, who was Dr. Debecky associate, who moved to Phoenix, I think. Yes, that terrific, they used to call him. And he, in fact, I'm talking about 1970 or so, that he already had the idea that surgeons should also be trained and performed endovascular procedures.
Endovascular procedures.
He was the first one, I think, I'm sure. He
Interesting.
was a smart person too.
So again, we are almost hitting our 1 hour mark. So I want Professor Tesler to thank you for this time. I wanted to invite everyone to read the book because I read almost, I think, more than half of the chapters, and I found them extremely interesting. And I will complete the reading in the upcoming days. The reading is very nice, it's very detailed, but at the same time, it's very pleased to read. It's not cumbersome or is not encyclopedic in the way in which a scientific article can be. This is extremely nice and very pleasant to read. So, A History of Cardiac Surgery, this is the book, and I want to thank you for your time and thank you for being here with us today. And I hope that you enjoyed too this presentation, and hope to see you soon, maybe in Ettore Majorana's foundation or in some other events as soon as COVID situation will allow us.
Thank you very much.
Thank you so much, Professor.
Thank you.
Thank you. Have a great day.